for tuning in. So what do you think?
No, I think it's great. You know, we don't have any studies that are going to show that it is harmful to the baby. You have an ultrasound beforehand to make sure there aren't any anomalies.
For sure.
Effects.
To
Yeah,
use
that would
the
be bad.
ultrasound for medical reasons or diagnostic is very, very, very
that-
important. And you don't want to find that out at the shower.
That could be a disaster.
Yeah, in front of everybody.
Yeah.
Oh, that would be terrible.
So Lisa, how far before hosting the party? Because I think maybe if you went and saw your doctor a week or so.
Depends on the weeks when you have your baby shower. And again, baby showers shouldn't be really, really late. I've had a lot of people who've missed their baby showers because they've done it at 37 weeks.
The baby came early.
Yeah, exactly. So if you're going to do it, you know, after 20 weeks, then after that 18 to 20 week ultrasound, because usually they look at the heart a little bit more then because it's more defined as the baby grows, because you do the one early, and then as the baby grows, sometimes you can see more defects if they're there, particularly in the heart weeks, 18 to 20 weeks, and so it would be a good time to do it after.
Ultrasound does not expose.
All right, ladies, so how cool is this? This is a giant pelvis. So this is what I work with as an OBGYN. And we're gonna open this up for the first time. You're gonna see inside exactly. Does this play a role in sexual function? Am I gonna lose my sexual function when you take out my uterus? And great to prove, again, we can take out the uterus and you're not gonna lose your sexual function. Actually, women, it improves afterwards because you're not bleeding. Study, and this is how the hysterectomy works. So this is real boon to women.
It sounds like the orgasm.
No. You only have history.
worried
As you see over there with the model, and that's what's important. A gynecologist to do it. There's a lot of things that can go wrong with anesthesia, with bladder, and what they're finding with robotic surgery, hysterectomies, it costs so much more money that you would be better off with a laparoscopic vaginal hysterectomy or a vaginal hysterectomy than opting for a robotic hysterectomy. They can be great.
Do you notice a difference between a woman being a
healing process? Yeah. You're going to heal faster if it's a vaginal hysterectomy. And that's the idea behind the laparoscopic and the robotic hysterectomy.
They are having a good time. The ages 20 to 50.
Get more of these. So all these things. Sally, you need to go see your ear, nose, and throat doctor. He's going to pass a little tube through your nose.
Oh, my God.
Oh, my goodness.
Dr. Orden.
Okay.
I've just.
Oh, I'm in.
I hope when I'm living in. We do have to go to break, but as I was watching those clips, there was a lot of wine drinking going on.
And, you know, we have three care of your gums. And as far as the nose.
Not such a good idea, Dr. Sears.
Yeah. Wow. I've never heard a baby need to get bleeped like that. Just what happens is the milk, the form can happen with you.
Absolutely.
Right?
I lived through that with Daniel, actually, because I had Daniel when I was in medical school, and he went, so watch out for daycares, especially. Even if you're doing everything right, if you leave your child with daycare and they prop your baby up, luckily they're baby teeth, and, you know, but he had to have a prosthesis until his adult teeth grew in. So his regular adult teeth, but
it
he
could
had
be a big problem.
Yeah, all of those removed, and you feel awful as a parent.
And until just last year that formula companies actually started listing the sugar content of the formulas. We didn't make as much saliva, so that sugar just really hangs on the teeth. Now, breast milk is different. It's, you know, maybe just use a bottle of water, or if you are going to use formula or milk afterwards, if a little bit of saliva action to kind of wash the teeth
Wiping
off.
those baby teeth off, yeah.
And I'll tell you what, these don't need to brush my teeth. You're also at risk because those sugars are going to hang out on your teeth. We're going to explain their age, because obviously a 2-week-old baby, you can't help yourself. Ooh.
And babies that learn those signs, they're less fussy and they show less tantrums because they're able to communicate earlier.